What's up, world? It's me, Nez. Welcome to Nez Telly. Today, we're doing something a little unusual. It's a recording of a conversation between a health worker in the isolation center and I. It's just here because we are trying to practice what we preach when we say that it is better to rely on things that you see and actually hear over the things that you just read in random places all over the internet. The rumors going around too much about this pandemic, they are too mind-boggling and they have a tendency to create unrest. Please understand, I am not here to share worry or fear. The point here is to get us to a point where there is hope and we know exactly what is happening and the best that we can do to make it work. Thank you so much to everybody that sent in questions when I actually asked if you had an opportunity to meet a health worker, what would you ask them? So, here's the video. Thanks for watching. Welcome Dr. Femi to Nez Telly.
Yes.
You guys, I am so honored to be in this man's presence right now. Don't worry, it's not somebody I just met today. He's a good friend of mine. But I'm actually honored by the fact that he is one of the people that I call the health heroes that are working in the isolation centers.
Yes.
In a, what center?
Yaba Isolation Center.
Okay, so what do you do there?
Okay, so I'm a volunteer doctor. I work there with case management, meaning we see patients, we see both the suspected and the confirmed COVID-19 patients.
Okay.
Yes, and we take care of them and we discharge them when they are good to go.
Okay. There's a common misconception when it comes to health workers, especially in this pandemic that is going on now. A lot of people assume, a lot of when they talk about the health workers, they only think of doctors and nurses. And we know those are not the only ones.
No,
Can you please shine a bit of light on that?
No, the thing is, the healthcare team is like a network of people that do the best to make sure that the patients have the best standard of care.
Yeah.
And interestingly, everybody is exposed, right from the security man who welcomes or directs those who are coming, is exposed to those who are negative or positive, to the nurses, to the records officers, even the cleaners. I want to say most likely the cleaners are even the most exposed.
Imagine that.
Because they have to go into the ward.
None of us don't think about
they are heroes
yeah.
too. They
They
have to clean the wards.
Yeah.
Sometimes they have to help clean the wards, clean the toilets, so that the patients will be able to have a conducive environment. So the heroes are not just the doctors and nurses.
Yes.
It's everybody, right from the security man to the man operating.
Even the ambulance, people that carry the people around.
Ambulances, even the electricians.
Oh.
Because there was a number of times that the sockets stopped working and the patients complained, and the electrician had to wear protective equipment to go in and sort it out. So it's a network of people that are all important. If the water stops working, everybody's in trouble. So the plumber is also very, very important. So the hospital has the engineering department, the security department, the stores, the pharmacy, the nurses, and the doctors.
So you said you're a volunteer doctor. You're a doctor?
Yes, I'm a doctor.
So me that I'm not a doctor and I don't have anything, can I volunteer?
Well...
Or if I could volunteer, what could I possibly do?
I think you could volunteer in busting myths, in spreading verified information online.
Okay.
So a few volunteers also worked at the call centers where they could pick calls and respond, because the COVID is a nationwide, worldwide pandemic. So you can't have too many people to listen and to encourage people. There are people who are positive but are told to isolate at home. Such people could get depressed because they are staying. I know someone who had to tell me that his wife was stigmatizing him, and that she would lock the room. When he comes out, he goes to the kitchen. Once he leaves the table, she sprays everywhere. I feel stigmatized. It was especially painful when he went to get a snack in the kitchen and the maid looked at him and said, "Oh God, you are not supposed to be here." So it was terribly hurt.
Yes. So even mental health experts.
Exactly. So people need others that they can talk to, people that can reassure them and know that this isn't permanent and it's just a phase. So those who want to volunteer can volunteer in those areas.
Okay, that's good. You know what you just said now? Okay, first of all, thanks again to everybody that answered my question when I asked you, like, if you met a health worker, what would you ask them and all that. I'm going to do what you just said now, about an attention to somebody. Julia's diary on Instagram asked, are there medications that are given? What medications are given to patients?
Okay.
And those that are infected but have to stay home, do they have care? They have workers that come, check on them, care for them, and all that?
Okay, so what we usually do when we see a COVID positive patient is we categorize. There's mild, there's moderate, and there's severe. Mild patients are those who can go home and be managed at home.
What does that mean? They are positive,
meaning they are positive, but they may have no symptoms. They may be asymptomatic, or they may have very mild symptoms like a blocked nose, nostril, a sore throat. So something that is not life-threatening.
So you tell them to go and
self-isolate, stay away from people, wear masks, and eat well. And we give them some medications. So those, unfortunately for now, the surveillance team tries to get in touch with them, but the logistics of getting to these people is too much for the society because they run into thousands. So for those who are moderate, then you need to, that means in addition to having these symptoms, they are breathing very fast, what we call dyspnea. So they have some level of shortness of breath. But there's a particular limit that is not life-threatening. So there's dyspnea, but it's mild. So they find it difficult to breathe, but it's not life-threatening. At that level, we make a judgment to whether they can stay home or they should stay in a facility. So, for instance, if someone is moderate and is above 45, we would like to admit that person because age is a risk factor. If the person is diabetic or hypertensive, those are more risk factors. So such a moderate case, yes, will be asked to stay in a facility. So severe are those who need oxygen, and for them oxygen is life-saving.
Oxygen is what we call the ventilator.
Not the ventilator. No,
they are different.
They are different things. Oxygen. So what COVID-19 does is it scars the lungs. So it's like it attacks the membrane of the lung. The lung is like a huge sponge that air goes through the sponge and enters the blood. So, but if anything scars the sponge, it becomes hardened, and so it can't soak in air, and the air can't enter the blood. So, if such a person is breathing normal air that we have outside is about 21% of oxygen. So it's a lot difficult for the oxygen to diffuse into the blood. So if you put a nasal prong, that's the small or a face mask, you concentrate the air the person is inhaling and exhaling. So you may raise it from 20 to about, let's say, 40%. So the person will be able to survive. The oxygen entering the blood will be enough till the person recovers, until the lungs are able to walk again. So what you are trying to do is, at no point should the person's body lack oxygen, because oxygen is essential to life. So you supplement the oxygen, you increase the concentration of oxygen in the air the person is breathing in, and support the person till they can recover. Then you will reduce the oxygen back to what is 21%. So for drugs, there's a lot of controversy about which drugs we use.
Because every time we heard about the thing,
what I can say is there's no verified drug that cures COVID-19. So what doctors do is they do supportive therapy. So if someone has headaches and has fever, we relieve that. If another person comes down with diarrhea, which is another symptom, we will give drugs to alleviate it. There are a few antiviral drugs that are still under trial, but none has been proven to work well. Chloroquine is being tried, but research is showing that it causes more troubles than those who do not use it. So there's still a lot of things being researched and found out, because COVID-19 is just 6 months old, and nobody can categorically make a statement that this works or this doesn't work. Yes, so that's it. So, and even if we know something works, it's unethical to go on social media and start saying use this drug. Because we're in Nigeria, you can buy antibiotics over the counter. You see people hawking medicines, tetracycline, ampiclox. You see people putting them on the heads, and every drug is a poison if it's abused. So I don't see doctors coming on social media to say you can use this drug, because unlike other countries, it's not regulated. That industry is not regulated in Nigeria.
Okay, thanks. So now that you said that, I want to talk about one of the myths I also heard.
Okay.
Are COVID patients being used, like, are they being used for testing? Like somebody literally said that they're being used for experiments right now. No, I didn't hear it for Nigeria though. Yes. I heard it for somewhere else. But do you think that's what's happening?
So what I will say, excuse me, my mask is coming a little low. I need to, so you can see I pull the rope. I don't touch. This is the dirty part of your mask. Okay. If you touch it, you've infected your hands.
Oh, interesting.
So you try to.
Okay.
Okay. So. Okay. I would want to ask a question. What do you mean by the experiments? Well, I don't know. Let me just continue. Okay. Because if something new comes out, you try something. If it works, you publish it. If it doesn't work, you publish it and tell other people not to try exactly what you've tried. Okay. So I won't say they are being used as guinea pigs. Okay. But whatever is tried, you have to report it so that the whole of humanity can understand. So we thought chloroquine was working, and a few people used it, especially on patients who were severe, and it was like you had nothing to lose. If a patient was almost certainly dying, even if what you're doing will give a 1% survival chance, you do it. Okay. So they published the results to show that this did not work, because chloroquine has some effects on the heart. Prolonged use could cause blindness. Prolonged use could cause hearing loss, irreversible, both blindness and hearing loss. So you have to build on the knowledge the existing knowledge. So I won't say they are being used as guinea pigs, but I would say whatever information people stumble on accidentally, they publish it for the entire community. So for instance, steroids was controversial, but so studies on people who use steroids show that they felt better than other people. Okay. So right now, severe patients are on oxygen and in the ICU are being given steroids. Interesting. So we keep building on existing knowledge.
Okay, that's nice. Okay, so all the questions I got from you guys were, first of all, you have to understand. I don't know whether people tell you that often enough. Your people that work in the health sector right now are being admired greatly. When I asked people what would you do, people were asking things like a lot of people are asking you, how are you doing? Yes. A lot of people are saying, so how are you doing? How are you handling it? One person even asked, can I have your account number? And I told the girl, like, are you serious? Because I'm ready to she hasn't had that. That's what she feels like saying. That she doesn't have the money to give, but she always wonders if I can. One guy said, can I give you a hug? Can I give you a hug? Someone said, how are you doing, Angel? So it's like a lot of people actually, they understand what's the work that you're doing. Yes, I don't know whether you're told that to your face or you ever hear it. Like when you tell people this is what you're doing. Because I know that right now we're not getting around as much. Yes. So I don't know. But I just know for sure that a lot of people they're in awe of people that are working in the centers these days, and they're just so thankful for the work that you guys are doing.
We appreciate that.
Okay, so let me see another question. Okay, yeah, another question is your mental health. Somebody, what's her name? Miriam Chineme Ogo actually asked, how do you take care of fear, worry, like when you have to take care of people, so you have to handle yourself first. How do you handle yourself before you take care?
That's a difficult one because first you are exposed. The virtue that you're in the same premises seeing COVID-19 patients means that you're definitely exposed more than the man on the street or the person who is on lockdown at home. So it's first, for me, I can only speak for myself. I know why I studied medicine, and I knew that I studied medicine to save lives. So irrespective of whatever conditions I have to work, as long as I know that I'm fighting a war, and anytime there's a war, some people have to be at the battlefront, while others have to be at the back. So I chose to be at the battlefront, so I knew I wasn't forced to be there. So that sort of put everything in perspective for me. Now, am I afraid? Regularly I'm afraid. I'm afraid that am I unduly exposed? Like something happened one day that someone knocked our call room and came in and said, "Hello, I've just been told I'm positive. Where do I go?"
I mean, it's not funny, but it's funny.
And we all were like, she opened our door. I was almost entering into our room, and we had to gently tell her where to go, and we sanitized the door handle. But literally, you can, however hard you try to protect yourself, you always get exposed more than the man on the street. So, fear. Sometimes I don't sleep well. I have to confess that there are times, since COVID started, I wake up more often. And I have, there are times I am just not happy. But I know I listen to music. I know a few things I do to get myself back into the right zone. Also talking to people.
That's another one to talk about.
Especially, so sometimes you have fellow healthcare workers you can talk to. And the Lagos State also has a psychosocial team that tries their best to cater to our mental health. But different people respond differently to stress, so it has to be something that is individualized. So we are coping, we are doing our best. It's been mentally challenging, especially some days where you lose patience, and it's heart-rending, but you still have to go on. And a lot of people say doctors are insensitive, but the truth is, do you want a doctor that if he loses a patient will leave his duty post because he's sad? Whether you're sad or not, you still have to get the work done and keep saving lives. So that's the difficult part, and we do our best.
Wow, well done.
Thank you.
Well done. So another person said, somebody asked whether the news is it downplaying or exaggerating the situation. Like personally, when I look at the NCDC thing every morning. That's the only thing. That's my only information.
Well, you shouldn't look at it every morning. It's not good for your mental health.
But that's the only thing I look at. I don't look at any other thing. No, like I don't watch the news. That's all I just know. I just know okay, this is the number.
I started looking at that 2 months ago. Even though I'm working in an isolation center. Seeing the numbers right every day.
And I want to mention that I noticed that in the 1st of June, between the 1st of June and now, which is the 20, we're at the end of June now.
Yes.
I felt like the number is like
it's ballooning up.
That's the number of infected people. Is getting like way more than since March.
Okay, so why do I say it's unhealthy for you to look at those numbers?
Why?
The truth is, COVID is an infection that snowballs. So the numbers will increase. I can guarantee that the numbers will go to 50,000, 100,000. I was amazed when I was watching CNN yesterday and I saw that they had reached 2.9 million confirmed cases.
In the world?
Not in the world, in the US.
Oh, okay.
Yeah, so in the US alone, so the number will keep increasing because we are close to 200 million naira. 200 million naira. If anybody hears that, if God is saying you should send me 200 million naira, please send. She knows my account details. So there are about 200 million of us in Nigeria, and whether we like it or not, COVID-19 is passing through. So the numbers will keep increasing until either we find a cure internationally or everybody has it and gets a level of immunity to it. So that is also questionable because they are doing research to know if it's like other diseases like chickenpox virus. If you have chickenpox, you have a lifelong immunity to it. But nobody can categorically say how long the antibodies to COVID-19 last.
Not yet, like you said, it's too young. Okay, so Achalugo's teachers, this person spoke to me on this thing, WhatsApp, asked how do you cope with babies, infants and toddlers?
That's good news. Children, babies, infants,
so far
they are very happy, they are running up and down, they are playing. They may have a few symptoms, but it seems as if they are immune to COVID-19.
Oh, that's beautiful.
So I remember once I entered the ward, we've had a patient who was in the 1st month of birth. Her mom, the baby's mom, contracted COVID-19 just around the time she gave birth to her baby.
Okay.
So she came in positive, and we had to treat her.
Mm-hmm.
And she recovered within 2-3 weeks, and she was back home.
Okay.
I called her recently. The baby is fine. The mother is fine.
Oh,
so
that's nice.
So we've also had a few toddlers, and when they see us in our suit, they think it's Barney. So I was happy when I saw the child gleefully clapping, and I did a funny dance, and the child was very happy. So that was a 1-year-old child. So it's children are fine.
That's sweet. Okay, so what is, I think this will be the last question, and this is from me. Okay, not the last, there's one more, but this is second to last. Discharged patients, what are their states? When you say they are discharged, they are fine, they don't need to take any medication again, they are good.
Yes.
So it's just basically checking up on them and...
Yeah, so when we discharge a patient, the criteria for discharge varies, but I would summarize that we only discharge people that we feel are healthy and can breathe, and they are not at any chance of losing their lives. And we give them the instructions to still self-isolate at home. Sometimes, depending on the state, sometimes as long as 2 weeks before they can reintegrate. So we also test them to make sure they are negative. Sometimes there are some patients that, due to the NCDC guidelines, we can discharge them home and tell them to come back for follow-up. So, but we discharge only patients who are healthy to go home and to stay at home. So I hear mates saying that people that go home have to be on oxygen.
Yes.
Or scary things
I
like
heard that. I was like, that's not possible. If they are not oxygen, that means they are not fine.
They are not fine. So most of the every patient that we discharge goes home without oxygen. So oxygen dependence is only for severe cases who have to be administered the oxygen in the hospital. So they go home, we ask them to come back for a checkup till we know they are truly negative before they can resume their jobs.
Okay, cool. Face shields versus face mask.
Wow, that's an interesting one.
We still having argument in this house because this face mask, I mean, we all know it's uncomfortable.
Yes.
I sweat a lot, so most times and I'm not taking public transport. My car was, did I tell you my car was boggled. So what that means is that when I have to go to the market these days, if my husband is at work, if he's doing something, I have to walk, literally. So it's like I walk a long way to go to work. I don't take public transport because I'm trying to social distance. So the thing is, I had a big argument with my king. I was like, Oga, we're going to buy face shield. Everybody in this house wear. There's one like glasses that will just wear that. So face, he doesn't believe that it works. He told me no, that this is more listening. So face shield versus face mask.
Okay, let me share a joke I saw online. Someone said, if you wear face shields, why do you want to wear face mask? And the person said, if you use seat belts, why do you need seat belts in a car when you have airbags?
Interesting.
And why do you use airbags when you have seat belts?
Okay, interesting.
And do you need brakes if you have seat belts and airbags? So, in all honesty, you need to be as careful as possible. If I was to choose one, I would say the face mask.
Okay.
Because we believe that COVID-19 is spread by droplets. If you inhale them, they go straight into your lungs or into your throat. So the face shield is very fashionable. You look techy.
It's not about the tech. It's just comfort.
It's comfort. I'm just telling you.
Comfortability.
It doesn't protect you. It protects your eyes from anything that splatters. Or if a patient coughs into your face, even if your nose is protected and the droplets fall into your eyes, you could be affected. Yes. But most of the time, the people that need face shields are those who are the healthcare workers. Say dentists who have to move close to the patient and are at risk of the patient coughing, because the patient will not announce that, excuse me, I want to cough. So the truth is, those are the people that need face shields. Do they protect you? Yes. But for the man on the street going around with face shield, it's minimal protection, and this is more efficient for those who are around. But if you want to wear both, yes, you get some additional level of protection.
Okay. So let's say this one is just me throwing that one out there. What frustrates you the most about the way the public handles the? Like I imagine, I know you work in Yaba. Yaba is a very densely populated place. When you come out, when you're driving home,
well,
after a very tiring day,
I would say it's ignorance. and the ignorance is quite annoying because.
Sorry, I think a better question is, what would you wish? What would you want people to do differently?
Okay, I would want people to know that COVID-19 is real, and it can destroy lives and it can destroy families.
You've seen it?
I had a patient who his uncle died of COVID-19. His dad passed on of COVID-19. His brother was on admission for COVID-19. Yes, he was discharged this last week. His brother his sister-in-law, his brother's wife, was just taken in for admission 3 days ago. He himself had all the classical symptoms. So it was painful to hear that 2 brothers, both in their 70s, were in the same morgue because of COVID-19. So, and there are people out there who say that this is a scam. So it's painful when you're trying to fight a war, you're trying to protect people, and many of them are just laughing and saying that it's a lie. So it's quite annoying, if I will put it that way, and frustrating. So if there was one thing I would want to change, I would want everybody to be on the same boat, that they would agree that we have a common enemy, COVID-19, and we should all fight in whatever capacity we can to overcome this enemy. But having our ranks split into those who believe that COVID-19 is real, COVID-19 is fake, COVID-19 is just malaria, it's really frustrating, because you have had people who, or someone who brought a parent in and lost the dad, and we told her it's COVID-19. She said no, it can't be COVID-19. And I was at this point, you've lost someone here, and you're still having doubts as to whether it's real. So it's quite, so that's the most frustrating thing, to have to explain even to the patients that you're treating that they indeed need care for COVID-19. So that's the one thing I would want to change.
Wow, thank you so much for spending time with us, Dr. Femi.
Thank you. It's always nice to be here.
Finally, he's been here before, right?
Yes,
I'll put a link to the last video we did together where we talked about this. And
please don't forget the 20 million. Okay, 200 million. If it's you,
please answer the Lord. Okay, I wanted to say something else. Dr. Femi is also a photographer.
Yes.
Right? So he went on to do this exhibition of a collection of art pieces, which you said that one of them has been selected by.
Yes, so I'm on British Council. Newsletter. The one that came out 26th of June.
Okay. Maybe I'll show you guys. I'll look for it. I'll show you in my next video.
The link.
And then I'll put a link on this video so you can see what you need to see.
The photos taken at
the photos that were taken at so you can see what it's like, you know. The idea, the bottom line of this is not to spread fear, it's to spread hope. It's to spread hope and to make you understand what's happening and what you can do. A lot of us, I think, our hands feel we're tired, we don't know what to do.
Yes.
A lot of us are scared, a lot of us are choosing to ignore. Some are just like, we don't know what to do. So like the idea is not to spread fear or panic. The idea is to spread hope and to get knowledge. I talk a lot about the importance of doing your own personal research.
Yes.
Just because it was written somewhere on social media does not mean that it is true. Okay? And this person is talking, he's not right. Thank you so much for watching. Bye-bye.
Bye.